Hi guys, it's Dr. Shelley, and this is going to be a great day. Yes, a really wonderful day, because you guys are going to love that our new series of videos is going to cover all the pink packets. It's going to take time because the pink packets are like huge to your success on the NCLEX exam. So remember, the first pink packet we're going to have our series of videos cover is the Oh My God packet. In fact, we're going to explain what these pages really mean. Have you looked at page 7 and thought, what is that? Have you thought about page 6 and wondered, wow, I think I better know that? Yeah, because what's page 6? It's a quickie. We all like quickies. And it tells you how to prioritize and what order to do it in. It also talks about who should get the floatners and who should we delegate to the new graduate and what should you never delegate to the floatners. Then you have page 7, and page 7 is the best page in the entire packet because it has the list of Oh My God emergents. People you better see first. And we're going to talk about that page. It's a really cool page. And then, of course, in my Oh My God packet, there's page 8. Prioritization, delegation. Then you have your infectious diseases, your immunology, and your seizures. That's nothing compared to what Miss Piggy has to offer you. Then we look at our page 10 and 11, and page 10 and 11 are select alls. Ooh, I know, right, y'all? I mean, I'm telling you, honey, I got you. But that's not it, because, of course, every nurse needs to know maternity and pediatric quickies and their diets and nutrition. Now, that was just the Oh My God packet. We have a shitload more. You know that we have our medication categories, and this bad boy was updated this year, 2024, with every category of medication you can imagine. You have your antihypertensives, you have your dysrhythmias and diuretics, you have your ICU medications like your vasopressors, you have your cardiovascular meds such as anticoagulants and thrombolytics. Then we move on and we look at some of the steroids and the NSAIDs, and we talk about statins, and we go into great detail about rheumatoid arthritis or immunological drugs that are going to treat lupus, psoriasis, sarcoidosis, rheumatoid arthritis, ulcerative colitis, and Crohn's. We talk about chemo. We talk about every drug category in this packet, even your antibiotics, like the difference between antibiotics, antifungals, antivirals. We just go through this entire packet and we talk about our psych meds. You know, psych meds and cardio meds are really the majority of meds on the test. But then, did you know in this same packet, there's also GI meds? Oh yeah, there's even ADHD drugs and asthma meds. But then it gets better than that. This packet has herbs and vitamins. Oh, and then of course we have our wonderful infectious diseases. And right in this infectious disease packet is your flashcard list that you need to make flashcards out of all those diseases. And then as we go through the packet, we can see very important things that maybe you didn't know were that important. Some of the things that we talk about in this infectious disease packet is the order of what you put your PPE on and how you take it off. I mean, come on, guys. This is your test. But we're not done. Yeah, we have the number one area of failure, reduction of risk and procedures. So this damn thing here, a good 30, 40 pages. And when you look in this, we're talking everything, right? We're talking blood transfusions. We're talking your respiratory, different procedures like trachs. Yep. Trachs. We're talking your feeding tubes. You know about that. We're talking about your colposcopy and your amniocentesis and thoracentesis. We're talking about catheters. We're talking about central lines. We're talking about injections and how to give them. We're talking about topicals like patches and ointments. We're talking about ortho or musculoskeletal issues like your sequential compression devices. Oh yeah, honey, even your eardrops and your eye drops. You see that? I'm telling you, y'all crazy not to get these packets. And then, of course, we have our safety issues. We have to remember all the different positions on the test. And if you look in this procedures packet, there's so many different positions that we include more than one page. And, there's that. But then I bet you thought we were done. No, we have your management of care. And as you know, this is the one that is least understood. People don't understand that this is ethical legal stuff, that this is workplace violence and conflict, like this is delegation and prioritization, like who do you see first? And that's okay because we hooked you up. We literally put all of these things in this packet in alphabetical order. So this little table of contents tells you everything that's in here. I mean, come on, it's so cool. You have, for example, a wonderful little S-bar, because you know that's on the test. You know that's on the test. Like, come on, seriously. You also have your delegation. But then, if that wasn't enough, we have how do you resolve conflict? People tell me that this part right here was a select all. That's what they tell me. I don't know. I didn't take the test that y'all took. When I took my test, it was for 2 days in Columbus, Ohio, and it was 2 hours per subject. And yeah, we didn't find out our results for 3 months. Yeah, so just in case you didn't know, there's also therapeutic communication. And there is, wherever there's therapeutic, there is, of course, non-therapeutic. Y'all see what I'm saying? Honey, auntie. And then we have our psych meds. And maybe you didn't know it, but the psych meds make up the majority of the meds on the test. And you start right with the #1 med of all, lithium. Lithium hunting. Yes, Jesus. Yes. So I'm just saying, I got energy and I got pink packets. And we're even going to have fun with our EKGs. And then pharmacology and how to use this one anyway. Because this one is the one that you have at your side. Every time you do your UWorld questions or you listen to a video, you go in here because it's alphabetized and you find that medication and you highlight that bad boy. And if there's anything missing, you write it down. Anyway, I've got to go. I've got things to do. This is my grooming day, so I got to get my hairs done and my nails done, and I will talk to y'all later. Love you. Stay tuned for Pink Packets tutorials. They're coming your way, baby.